Welcome to Integrity Linguistics Institute. So here, if you have proper knowledge regarding singular tense, plural tense, and plural tense, if you have proper knowledge, you can eliminate one answer option, and another answer option also can be eliminated with the right strategies. Keyword analysis, that will definitely help you out. All right, so let's register this information. So step number one, what is step number one? It is comprehension of the question, right? So first and foremost, it is comprehension that happens over here. So once you have comprehended, what is comprehension? It is all about understanding the question, right? And then comes retention. So once you have understood the question, you have to register the memory of the question to your mind. You must not forget what you understood. So with that memory in your mind, then only you have to go and detect what the answer is. Right. So over here, comprehension, it usually involves keyword analysis. That is, you have to identify the keywords and you have to link the keywords together. Okay, it helps you grasp the main focus of the information. And then it once comes to detection of the answer, okay, there you can bring in the verb analysis, right? So the verb analysis will help you to eliminate the incorrect answer options one by one. And also you must be very good at elimination strategy. That is, even if you struggle, if you're struggling with finding the correct answer, that is completely fine, right? This is OET that we're dealing with. The language is very advanced. So if you are struggling with finding the correct answer, you should be able to eliminate the incorrect answer options. That is, see, some of you have written answer option A over here, right? But if I'm going to ask you, explain to me why B is incorrect and why C is incorrect, you should be able to say it with very good clarity why B is wrong and why C is wrong. Okay, because elimination is even more important than selection of the correct answer. So let's comprehend the question, right? So let's do what the keyword analysis is all about. So let's understand the question. So here it is an obligation based question, right? Because see, what is the word over here? The word over here is must. Okay, what must all the staff involved in the transfusion process do? Okay, so people, that is the medical staff who are doing blood transfusion, okay, whether they like it or whether they don't like it, they have to do one of these things. That is either A, B, or C. It is an obligation. They cannot say no to it. Right. So what is answer option A? Okay, they must check that their existing training is still valid. Okay, that is their validity, their existing training has not expired. See, for example, like everything has an expiry date, right? So every year we have to renew your medical license. So our driving license, our medical license, our training license and all, it needs to be renewed. Okay, if if the validity is expired, then we cannot work there. We have to once again write the examinations and we need to renew our license, right? So here, what must all the medical staff do? Whoever are working in the transfusion process, they must compulsorily check that their existing training has not yet expired. That means it is still valid. Okay, that validity is still going on. Answer option B, they must attend a course. Now see over here, the singular tense and plural tense. So here, what is the tense over here? A basically means just one. So that means they have to compulsorily, they have to attend one single course. And what is this course teaching about? Teaching about new procedures. Okay, so this particular course over here is explaining about new procedures. Answer option C, they have to read one document. Now see, what is the tense over here? It is singular tense. It is not plural tense, right? So they have to read compulsorily. They have to read one single document that explains. So what does this document do? This document is explaining changes in the policy. That is, previously the policy was like that. but now presently some changes have been made. So this document over here is explaining changes, and they have to read that one single document. Okay, so give importance to the tenses. Okay, see all these tiny words, it will definitely help you in eliminating the incorrect answer options. So we have done the keyword analysis. So now let's identify the stem of the question stem, and also let's do the verb analysis. So here, what must all the medical staff doing the transfusion process do? So what is the verb over here? The verb over here, verb means action. Okay, action words. So what is the action over here? Check that their existing training is still valid. So they have to check, okay, whether their existing training is still valid. Okay, so this is the entire thing. So we can basically say this is what they have to do. Answer option B, what is the action over here? They have to attend one single course. They don't have to attend two course, three course. They only have to attend one single course, which is about teaching, which is teaching them about new procedures. So that is the second obligation that they have to do, right? According to answer option B. Now, what is answer option C? They have to read one document. So what is the action over here? Read one document. Okay. And this document is all about changes in policies. Now you see over here, check whether the validity is not yet expired, attend a course, read a document. Now see, very long, lengthy answer options. We have made it very tinier. Now it is easier for you to remember these things. Don't you think it is much more easier for you to remember these small words? So this is how you have to comprehend the question and retain the focal point of the question and answer options to your mind. Okay, so give maybe 2-3 seconds extra for the question. It is always going to be worth it. Right. So now with the memory of the question, you have to go and read the paragraph. So remember, you have identified this as an obligation-based question. Obligation basically means it is a very strong word. There is no flexibility. Okay, it's completely rigid. The medical staff have to do one particular thing. Right. So let's see what is that. So okay, my duty is to find what is compulsory for the medical staff. What must they do? What they cannot skip. That is what you have to keep in your mind. And with that in your mind, you have to read with a lot of calmness. So again, see, if you can be a very strong candidate, but if you allow, your anxiety, your nervousness, your tiredness to, impact you, then it is going to be very difficult. Okay, so again, remember the OET is not assessing your language proficiency. The OET is assessing whether you can perform under pressure. Always remember that. Okay, so give, you should have the capacity to endure pressure and perform under pressure. No matter how much stressful situation you're going through, you have to forget about everything else. Stay very fixated on this particular question. Okay, and focus your entire awareness on that. So that is a skill that you need to develop. Right. So with a very calm mind, with a good memory of the question, let's read the question. Right. Right patient, right blood assessment. So here you can scan and skim. Okay. So scanning is, as I told you, going through each and every word. Skimming is basically means skipping the inessential information. Right. So here, if you have a thorough memory of the question, you can scan and skim the content over here. Okay. So, but you should know which information is important and which information is not important. Only if you have that clarity, you can scan and skim. If you don't have clarity regarding which information is important, then you cannot scan and skim. Right. So that is why comprehension of the question is very important. So let's, read the question. So here, basically, I'm teaching. So I cannot simply scan and skim. For the sake of making you understand, I have to read every single sentence as it is. Right. So anyway, let's read the sentence over here. Right patient, right blood assessment. Okay, so here this is the name of the policy. Okay, is there a policy over here? No. Okay, right patient, right blood. Okay, assessment. So let's read what the first sentence is. The administration of blood. Okay, the blood administration can have significant morbidity as well as mortality. So mortality is death and morbidity is basically disease. So blood transfusion is not a very safe, process. Okay, it requires a lot of vigilance, because if it is not done correctly, Okay, if the right patient is not receiving the right blood, it can have very serious consequences. It can cause very serious death rates as well as disease conditions. So from the first sentence itself, we are understanding the seriousness of blood transfusion. So again, you have to sense it. Now let's read the second sentence over here. Following the introduction of the right patient, right blood safety policy. So what is the meaning of following? See, I have given this example before, right? So for example, if someone is following me, so I'm walking in a park, someone is following me. That means what? I am in front of them, they are behind me. So I am walking first, they are walking second. Okay, so that is the meaning of following. Following basically means second place. Okay, not the first place, the second place. So following the introduction of right patient, right blood safety policy. So first, what was implemented? First, this safety policy was implemented. Right patient, right blood. So this is the name of the policy. So first, this was implemented. Behind this, after this policy was implemented, after this policy was introduced, then, this compulsion came. That is all staff, every single staff involved in the transfusion process, okay, oh god, okay, must be competency assessed. Okay, so first what happened? First, a policy was introduced, right patient, right bill policy. After that policy was introduced, secondly, what happened? Following, secondly, okay, there came a rule. The rule is that every single staff, so over here, every single staff involved in the transfusion process, they must be competency assessed. So what is the meaning of competency? Can anyone type the answer in the chat box, or you can unmute yourself and type your, tell me, what do you understand by the term competent or competency? What is the meaning of competency or competent? What is the meaning of incompetent?
Enable.
Can you please repeat?
Incompetent means enable, sir. Competence means can able to perform.
Yes. Okay. That is a close good answer. I would say it is like 90% correct. Enable skilled efficiency. Yeah. So skilled. Okay. So yeah, enable efficiency skilled. So competency. See, competent. Okay. So competent basically means what? See, competition. Okay. So yeah, that's both of you have gave the correct answer. Competent. Okay. So when someone is participating in a competition, what they will do, they will practice, right? Whether it's a dance competition, whether it's a music competition, what they will do, okay, they will practice. They will make sure that their skills, okay, that they are highly skilled, that they're highly efficient, that they are enabled to perform that particular activity. Okay, only then they will enter the competition, only then they will get the first prize. Okay, so that is the meaning of competent. Competent basically means skilled over here. They are skilled. So if a person is incompetent, if the person is incompetent basically means what? That means that person is not skilled. Okay, so you have to, again, without knowing what is the meaning of competency, you will not be able to get the correct answer over here. So that vocabulary is extremely important. Right. Okay, so that is a very good participation. All right, so over here, what is the guideline telling over here? All staff involved in the transfusion process must be competency assessed. Assessed means what? Assess is basically another word for check. Check the patient, assess the patient. Okay, it is basically a synonym. Right, check and assessment are basically synonyms over here, and competency is basically whether they are skilled or not. So every single staff who is doing the transfusion process, they have to ensure that they are highly skilled. Okay, and if they are not skilled, they must not do the transfusion process. That is what it is saying over here. Right. Now, this is the important word, must over here. Again, this is an obligation over here. So you have to give importance to very, very strong words such as must. Okay, so let me just highlight that single word over here because that is extremely important. Must be competency assessed. Now, let's come to the next sentence over here. To ensure the safe administration of blood, to the intended patient. Intended basically means what? The target patient. Okay, the target patient. Okay, this is you are the intended person. So it means you are the target over here. So the safe administration of blood to the that specific patient. All staff must. Now see, once again the word must is coming. So that is a very strong word. Okay, these are what we call as modal verbs. MODAL, modal verbs, right? It's a very strong word over here. So all staff must be aware of their responsibilities in line with professional standards. So here, what are they telling? Every single staff, they must be aware. Aware basically means what? They must be knowledgeable. They must be knowledgeable about their responsibilities with these standards, the professional standards of blood transfusion. Right. Now let's come to the second paragraph. So here also the word must is coming. Now see, the word must is coming. Again, this is an obligation based question. So you have to give importance to these words. The staff must, okay, the staff must ensure that if they take part in the transfusion process, that is, if they're taking part in the transfusion process, their competency assessment. Now see, assessment basically means what? Checking. Okay, competency basically means what? Their skill level. Competency basically means their skill level. That is, their competency assessment is updated every 3 years. So that means what? The validity for their competency is only for 3 years. After 3 years, it will become expired. And after 3 years, they have to renew their license. Okay, they have to once again write the examinations. They have to once again do the theory and practical, and they have to get a new license. So what is the compulsion over here? Okay, they must make sure that their competency assessment is updated every 3 years. Okay, otherwise, if it is expired, they must basically not participate in the transfusion process. Now let's come to the next important thing over here. All staff are responsible for ensuring that they attend the mandatory training identified for their roles over here. So they have to attend the mandatory training. So the means just one. Okay, one single mandatory training they have to attend, identify their roles. And here they are telling relevant training courses. So here, what is the tense over here? The tense is plural tense. Relevant training courses are clearly identified in Appendix 1. That is, the in the beginning of a book. So beginning of a textbook and all, you can see the list of chapters, right? Chapter 1, chapter 2, chapter 3, like a synopsis. So that synopsis is what we call as appendix. Okay. So relevant training courses are clearly identified in appendix 1 of the mandatory training matrix. Okay. So here some important words are coming. So let me tell you what those important words are. Now let's take a look into the answer options. Okay, let's take a look into the answer options over here. So what is answer option A telling? Answer option A is telling that every single staff, okay, whether if they're participating in the transfusion process, they must check. So what is the verb over here? Check. Okay, check whether their existing training is still valid. Okay, so here every single keyword is mentioned. Okay, so check. What is the verb over here? Check. So what is the synonym that we're getting? Assessment. Okay, so they have to assess whether their training, that is existing training, basically means their competency assessment, it is valid. That is, the validity is only for 3 years. So if it is expired, then they have to make sure that they once again renew it. Okay, so we can say that the verb is mentioned, and also using synonyms, the keywords are also mentioned. Right. So we can say that answer option A could be the right answer. It is highly likely that answer option A could be the right answer. Right. So now, anyway, let's say that let's assume that maybe you believe B is the right answer. Right. So let's come to answer option B. So what is B option telling? B option is telling they have to attend one single course. They have to attend one single course that teaches them about new procedures. Right. Now, if you take a look into the paragraph over here, nothing is mentioned about new procedures. Did we read anything about new procedures? That is, in the past, that was the procedure. Now, presently, recently, a new procedure is coming. So this keyword is not mentioned. Not only that, here, what is the tense over here? The tense is singular tense. They have to attend one single course. But what is the tense that has been used in the paragraph over there? There they have used plural tense. So we cannot choose answer option B. Okay, so let's take a look into the course over here. Now see, relevant training courses. Okay, so there is a very big difference between mandatory training. Training is different, course is different. Okay, so here the tense is courses over here, and they are basically telling it has just been identified in the appendix 1. Nothing mentioned, there is nothing mentioned about one specific course and nothing about one specific procedure. So for those reasons, what can we do? So this is singular tense. Okay, and it is not mentioned over there. And over here, what is the keyword over here? New procedures. No information related to that. So if it is not mentioned, answer option B can be very easily eliminated. Right. Now, what is answer option C? Answer option C is telling they have to compulsorily read one specific document that explains changes in policy. Now, did we read anything about policy changes? Again, change is a verb over here, right? So we did not read anything that was explaining changes in the policy. And there is no one specific document. Okay, that is, they have to compulsorily read a document is not mentioned. So here it is just an expectation. All staff are responsible. So here they're telling they are responsible for ensuring they attend the training program and relevant training process identifying this thing of the thing. So there is no obligation that they have to compulsorily read a document and attend a course. So even if you are struggling with choosing answer option A, you must be able to eliminate B and C. So if you have eliminated B and C, then even if you are not too sure about answer option A, you can choose answer option A. So this is why elimination strategy is extremely important. You have to perfect the elimination strategy by giving importance to the tenses, the keywords, and also the focal point of the question. Right, then it becomes much more easy. And remember, if you're doing reading part B first, then you should not waste too much of your energy over here, because if you waste too much of your time and energy over here, then you will really struggle in reading part C. Right. So here I have made one small document over here. So I'll be sharing this document to you after the session is done. So this is a obligation based question that we read. Right. So what must the staff do? So this type of question asks about mandatory actions. That is what staff are required to do. Okay. So over here, very strong words like must, responsible, mandatory. Okay. These type of words you should be looking out for. That is, even before you read the paragraph, you have to train yourself. Okay. This is what you have to go and find out. So how to spot this question type? So in the future and all, like verbs of obligation. Okay, must. Okay, this is the most common word. Need to. That you have to do this. Okay, you can give importance to these type of verbs, right? So this is the question over here. And again, answer option B. Okay, attend a course. Why is answer option B wrong? About learning new procedures. Okay, they must attend. Okay, the extract says they must attend mandatory training only. Okay, they have not mentioned anything about a course. Okay, it is not a course and it is nothing mentioned about new procedures. So it is not mentioned, so it can be eliminated. Right. And answer option C, read one document. So there is nothing about that. They have to read one document that explains changes in the policy. Okay, so it doesn't say, the paragraph doesn't say anything that the staff must read a document. So this is a distractor. So you have to identify which information is a distractor and which information is related to the answer. Okay, so like that. And answer option A is correct, because here they told staff must ensure that if they take part in the transition process, their competency assessment is updated every 3 years. So they must check. So what does that mean? It means they must check and update their training, which matches with answer option A. Right. So here there is a list of vocabulary over here. So competency. Competency basically means skilled. Okay. Their skill level is what we call as competency. So without understanding competency, it is not possible to choose the correct answer. Otherwise, you have to be very good in eliminating the incorrect answer options. Right. So let's take a look into the fourth question. Right. So this is a policy interpretation, right? It is not an obligation. So let's take a look into what the policy or the guideline is saying. So the guideline is saying the guidelines, okay, establish that the healthcare professional should. So the guideline is expecting something from the healthcare professional, right? So answer option A, B, and C. What are all these things? They are expectations from the healthcare professional. Okay, that is what they are supposed to do. That is what the medical professional, healthcare professional is supposed to do. Now, see over here, as I told you, when you are reading the paragraph over here, there is no need for you to read the entire thing. Because as I told you, okay, this is an expectation from the healthcare professional. So only that sentences I need to read. So here, this is where you can bring in your scanning and skimming, scanning and skimming basically strategies over here. Now see over here, a patient may specifically request a chaperone or in certain cases may nominate one, but it will not always be the case that a chaperone is required. Now you see over here, this sentence is not an expectation, demanded from the healthcare professional. It is just it is just a situation. They are just mentioning a situation. Okay, so here they're just telling a patient. So a patient may request a chaperone. Chaperone basically means what? Chaperone basically means a companion. Okay, so that is a companion. So sometimes patients, they are very sick, they are in a wheelchair and all that. So they need some help, right? They need someone to accompany them. So that extra person, like bystander, right? Okay, we still bystander, right? So that extra person who's there as a bystander to help the patient, that is what we call as a chaperone. Okay, so it's a medical term over here. Now, see, anyway, your duty is to find what is expected from the healthcare professional. But when you read the first sentence, nothing related to the healthcare professional is mentioned over here. Here they're just telling a patient may specifically request a chaperone or in certain circumstances may nominate one. Okay, that is, they themselves will nominate a person. That is, I want this person, I want that person. That is the meaning of nominate. Nominate means I want this person as my chaperone. I want that person as a chaperone, right? But it will not always be the case that a chaperone is required. Okay, so I'll come to the explanation later on. Now, over here, it is often a question of using professional judgment to assess an individual situation. Now, see this sentence over here. Okay, so this sentence over here is an expectation coming of, expected from the healthcare professional. So here it is often a question. So here it is a very advanced word over here. So here they are telling the healthcare professional, the guideline is telling the healthcare professional must use their professional judgment. That means they have to use their intelligence. The healthcare professional must use their intelligence to assess an individual situation. So this is an expectation, right? So that sentence is important. Now let's come to the second part of the sentence. If a chaperone is often declined, this must be clearly documented in the, sometimes this document, this must be clearly documented in the patient's record along with any relevant discussion. Now see this sentence also is an expectation. That means the healthcare professional must clearly document. That means they have to write everything in the patient's record along with any relevant discussion. Right. The chaperone should only be present for the physical examination and should be in a position to see what the healthcare professional undertaking the examination or investigation is doing. Now see over here, this sentence over here is what the chaperone must do. The chaperone should do so and so. But what is your duty? Your duty is to find what the healthcare professional must do. Right. Now over here, they're telling the healthcare professional, okay, the healthcare professional should wait, okay, until the chaperone has left the room or cubicle before discussion takes place. Okay, before takes place in the on any aspect of patient's care, unless the patient specifies the chaperone to remain. Okay, so this is the takes place. Okay, now see over here, these are the three sentences. Okay, these are the three portions where the guideline is saying something to the healthcare professional. Okay, so the healthcare professionals, what is the first thing? The healthcare professional must use their professional judgment to assess an individual situation. That is the first expectation. What is the second expectation? The healthcare professional must be clear, they must clearly document everything in the patient's record along with any other relevant discussion. So that is the second expectation. Right. And what is the third expectation? The healthcare professional should wait. Okay, they should wait until the chaperone has left the room. So they have to wait until the chaperone has left the room before any discussion can take place. Or else, unless the patient specifically requests the chaperone to remain. Now over here, okay, so if you want, you can, okay, this is enough. It is basically an extension of this information, right? So like this is how you have to scan and skim. See, if you understand the question very thoroughly, here, if you're giving 2 or 3 seconds extra, that few seconds extra you're giving for the question, it will help you to save a lot of time in the paragraph over here. Because you know, okay, my duty over here is to find out what is expected from the healthcare professional. That is the only thing I need to find out. So when you're reading the paragraph, you will be able to, you should have the capacity to give importance to the expectation of the healthcare professional. Every other information, you can just simply scan and skim. So this is how you can save your time and you can conserve your energy. And that time and energy you can spend it for reading part C questions. Right. So anyway, let's take a look into the answer options. Let's comprehend the question. Again, so what I just told you is a small strategy. Okay, it's a small strategy. Okay, so anyway, now let's come and take a look into the answer options over here. So answer option A. Okay, medical professionals, they should aim to. Yes, Ganesh. So just give me a small second. Sometimes this Wi-Fi is exactly 10:30, right? Exactly at 10:30, sometimes this Wi-Fi goes. Okay, so I'm actually using my smartphone's Wi-Fi. I'm not sure if the clarity is there. All right, so just give me a small second. Yeah. All right. Okay, so I hope my audio is clear because I'm using my smartphone's Wi-Fi. All right. So let's take a look into this particular question over here. Right. So the guidelines establish, okay, that the healthcare professional should answer option A, aim to make patients fully aware of their right to a chaperone. So what is answer option A telling? That is the healthcare professional, their main aim, that is their main goal, the main target, the main ambition of the healthcare professional is to make patients fully aware. Okay, make patients fully aware of their right to a chaperone. Okay, so this is what answer option A is telling. So fully aware basically means what? Fully knowledgeable. Aware basically means knowledgeable. That means the healthcare professional must, their main aim, their main goal is to give patients full awareness. That means they must go to each and every patient and they must tell the patient, see, there is no need for you to be alone. In a hospital, you have a right to a chaperone. And then they're going to the second patient. And then they're going to the third patient. And then they're going to the fourth patient. And what is the goal? What is the aim of the healthcare professional? To give information to all the patients regarding their right to a chaperone. Right basically means what? That is, they deserve, okay, they deserve a chaperone. So that is what answer option A is telling. Now, what is answer option B telling? Evaluate the need for a chaperone on a case by case basis. Okay, so here the guideline is telling, okay, the healthcare professional, they must evaluate. Evaluate basically means what? Assess, okay, check. Okay, that means they have to use their professional judgment and they have to evaluate. Okay, they have to assess whether whether there is actually a need for a chaperone. Okay, on a case by case basis. Case by case basis basically means what? One patient is one case, right? Second patient is another case. So here the medical staff, they must go individually, okay, to every single individual patient they have to go and they have to assess whether this individual patient, they need a chaperone or not. Right, that is what answer option B is telling. Answer option C is telling they have to respect the wishes of the patient above everything else. So here it is a very, very strong word that is telling above everything else. That is the number one priority. The number one priority is to respect the wishes of the patient. So whatever the wishes of the patient is telling, I want to get discharged today. The patient is telling, I want to get discharged today. Then the healthcare professional, okay, your wish is my command. You can become discharged. The patient is telling, no, I want to stay in the hospital for 10 more days. The health, okay, you can stay in the hospital for 10 more days. That is, whatever wish the patient is telling, number one priority should be given to the wishes. Right. So that is what answer option C is telling. Right. So anyway, let's do the verb analysis very, very quickly. So let's take a look into the verbs over here. The guidelines establish what the medical professional must do. So what is the verb over here? Make patients fully aware. Okay, so this is the action over here, right? They have to make the patients fully aware regarding their right to a chaperone. So that is the verb over here. So this is what they should do. That is, to each and every single patient, they are going and they are spreading awareness. You deserve a chaperone. You deserve a chaperone. You deserve a chaperone. Right? Now let's come and take a look into answer option B. What is answer option B telling? Evaluate the need for chaperone on a case by case basis. So what is the verb over here? What is the action over here? Evaluate. Okay. Oh, evaluate the need for a chaperone on an individual basis. That is, every single patient individually, they should go and they have to check whether they need a chaperone. So if it's a healthy patient, if the patient can run, if the patient can jump, do they need a chaperone? No, right? So individually, they have to go and they have to check whether they need a chaperone or not. What is answer option C telling? Respect the wishes of the patient above all else. So here, what is the action over here? Respect the wishes of the patient. That is, the number one priority is to respect the wishes of the patient. Right. Now you see, long sentences is now very small sentences. Okay. They should make patients fully aware. They have to evaluate the need for a chaperone and they have to respect the wishes. Okay. So at least this small information you must be able to register into your mind. Right. Now let's take a look into the thing over here. Okay, so let's take a look into the answer of this thing over here. As I told you, you should be able to locate which information is an instruction to the healthcare professional. So here, the first sentence is telling a patient may specifically request a chaperone. Okay, a patient can request a chaperone. In certain circumstances, they can nominate one. So if a patient is admitted to the hospital, they can say, I need someone to help me. Or they can say, I want this person as my chaperone. They can nominate a person. But it will not always be the case that a chaperone is required. So here they're telling, but it will not always be the case. So what is the meaning of that? Not always the case. Chaperones required. That means even if the patient is telling, I request a chaperone. The patient is telling, I am nominating a chaperone, there is no requirement for the chaperone. Means the patient is very healthy. The patient is very healthy. They don't need a chaperone. The patient is just very lazy. The patient is very lazy. So therefore, they need someone, to help them because they're lazy. So that is the meaning of not always the case a chaperone is required. Means there is no requirement. Right. Now, who is deciding? So who is the person who decides whether a patient needs a chaperone or does not need a chaperone? Okay, so that person who makes the decision is the healthcare professional. So here they are telling the healthcare professional. So that is why I highlighted this particular information over here. So this is an instruction to the healthcare professional. So here they're telling it is often a case of using professional judgment to assess an individual situation. Means whether a patient needs a chaperone, whether a patient requires a chaperone, that decision is to be taken by the healthcare professional. And how should they take the decision? By using their professional judgment. They have to use their medical experience and they have to use their judgment to assess an individual situation. That is, they have to take one individual patient, they have to assess the patient, and they have to truly check, okay, this patient is very serious, this patient is very ill, so therefore this patient definitely needs a chaperone. Right. So like that, the decision needs to be done by the healthcare professional. Now, what is answer option B telling? Answer option B is telling evaluate. Okay, assess. What is the synonym for the word assess over here? What is the synonym for the word evaluate? Evaluate basically means to assess, right? To evaluate the need for a chaperone on case by case basis. Case by case basically means individual situation, right? And whether they need a chaperone or not. Whether they need a chaperone or not is whether a chaperone is required. Okay, so you have to make the connection. Okay, so as you can see, the keywords are connected like this. Chaperones required, need for every single keyword is repeated. The verb is also repeated. And this is what is expected from the medical professional. So what you can do, you can suspect that answer option B could be the right answer because every single keyword and every single word is mentioned over there. Right. So B is highly likely to be the right answer. All right. So now let's come to the next portion. If a chaperone is offered, okay. So now we took the decision. So the medical staff, they assess the individual and they tell, okay, I'm giving you a chaperone, but it is declined. Now, what is the patient doing? The patient is declining. We are offering them a chaperone. The patient is declining. So what must the medical staff do? See, this is why I highlighted this information. This is an expectation from the healthcare professional. So what is expected? If they are declining the chaperone, this must be clearly documented in the patient's record. It should be document means they have to write everything in the record along with any relevant information. Now over here, see, there is nothing. There is nothing mentioned about documentation of everything. There is no answer option over here. No, not a single answer option is talking about that is if a chaperone is declined, they have to write everything. So that is not relevant to us. Right. Now let's come to the next information. Now see, this is an expectation of the chaperone. The chaperone should, but what is your duty? Your duty is to find what the healthcare professional should be doing. Right. So here they're telling the chaperone should. So this is a distractor, which means you can simply scan and skim. There is no need for you to read this information with too much detail. So that ability to discriminate which information is useful, which information is not essential, that ability, if you are having, it is very good. Right. So the chaperone should only be present for the physical examination and should be in a position to see what the healthcare professional undertaking the examination or investigation is doing. That means the chaperone should be able to see, okay, they should be able to see what the healthcare professional is doing. Right, that is what it is saying. But again, it is not at all important to us. Right, now let's take a look into the third instruction, the third expectation from the healthcare professional. The healthcare professional should wait. Okay, what they're supposed to do, they should wait until the chaperone has left the room. So the patient is there, the chaperone is there. So the healthcare professional should wait for the chaperone to leave the room. Okay, cubicle basically mean room before discussing anything with the patient. So the healthcare professional is going to have a discussion with the patient. The healthcare professional must wait for the chaperone to leave them alone. So only the patient and the healthcare professional should be there. The chaperone should not be able to hear their conversation, right? Unless the patient requests the chaperone to remain. But if the patient is requesting, actually let him stay over here. So if the patient is requesting that, then only in the presence of the chaperone, they can have this discussion. But as you can see over here, nothing related to that is also mentioned. It is they have to wait for them to go away from this thing, right? So what is answer option A telling us? Answer option A is telling the what is the verb of here? Make patients fully aware regarding their right to a chaperone. Okay, so this is the keywords over here and nothing related to that. Okay, that is the healthcare professional. The healthcare professional, their main aim is to give awareness, is to give information regarding the right to a chaperone. Nothing is mentioned regarding that. So we can eliminate answer option A. Now, what is answer option B? Evaluate. Yes, assess, right? Now see, assess an individual situation. Okay, so that is mentioned, right? So case by case cases, that is also mentioned. So the keywords are completely mentioned. Evaluate is mentioned, case by case is mentioned. And what is mentioned over here? The need for a chaperone. That means a chaperone's requirement. So every single keyword and every single verb is mentioned over there, right? All these are mentioned. So you can highly suspect that answer option B could be the right answer. But what about answer option C? Answer option C telling respect the wishes of the patient above everything else. Now, see, it's a very, very strong word. Means if the patient is telling anything, okay, according to the guidelines, this is what they have to do. Okay, but over here, respecting the wishes of the patient, that is mentioned. Now, see over here, answer option C is telling the chaperone, I mean, the healthcare professional should respect the wishes of the patient. So this is definitely mentioned because in the last portion, they are telling if the patient is telling, if the patient is wishing, okay, let that chaperone remain. If the patient is telling, no, don't, there is no need for him to leave, let him remain. So in that case, we can respect the wish of the patient. That is only in that situation. Only in that situation, the healthcare professional should respect the wish of the patient. That means the presence of the chaperone, right? But this particular word above everything else basically means what? Means if the means we have to give importance fully to the patient. See over here, see what is answer, what is this information telling? Chaperone is required. Now see, the healthcare professional, so listen to me very carefully. So the healthcare professional is assessing an individual patient, and the healthcare professional is telling you are a very healthy patient. You are a fantastically healthy patient. There is no need for a chaperone. Right. There is no need for a chaperone. The healthcare professional is telling. But the patient is telling, no, no, I'm very lazy. And because I'm very lazy, I need a chaperone. Okay. So will the medical staff give a chaperone to the patient? No. Right? Because it is not required. See, that is the meaning of above all else. Above all else basically means whatever the patient is telling, we are giving that to the patient. So that means if if the medical staff is telling you don't need a chaperone, but if the patient is telling I need a chaperone, that means even if they don't need it, we are giving them the chaperone. Right. So that is not wrong. I mean, that is not correct. Okay. So even though this portion is mentioned, okay, this portion is not correct. Above everything else, we have to obey. We have to blindly obey the patient. That is not mentioned. So for that reason, answer option C is incorrect. So if A and C is incorrect, that means by default, answer option B will become the right answer. And it is definitely the right answer because in the very beginning itself, every single thing is mentioned over there. Right. So this is how you can deal with policy interpretation type questions. Right. So let me just take this particular document over here. All right, so this document over here is a policy interpretation type question, right? So once you deal with these type of questions, let's see how you can identify these type of questions. So again, should, expected, guidelines, establish, okay, assess the situation. So these are all expectations. These are not obligations. These are not compulsions. It is just a recommendation. It is just a suggestion. Um, it is just an expectation from them. So there is a little bit of flexibility over there. Right. So again, the chaperone, again, I have made a small extract of the summary over here. This extract explains the chaperone is not always required. Okay. Again, it is sometimes the patient is very healthy. They don't require a chaperone and they must use their professional judgment to assess the patient individually. That is case by case cases. They have to go and assess the patient. The chaperone is declined. It should be documented. The chaperone is present. It should be in the physical examination. So these are the expectations coming from the healthcare professional, right? So you must be giving importance only to that, and you should be able to eliminate. So again, eliminating the incorrect answer options is very important. Right, it's an aim to make patients fully aware of their right to a chaperone. There is nothing, so nothing regarding that is not mentioned. Does not mention anything regarding this. So therefore, we can eliminate answer option A. Answer option C, respecting the wishes. So this is mentioned. Respecting the wishes of the patient is mentioned, but above everything else is too strong. As I told you, it is just too strong over there. Okay, so that is not supported. It is not supported by the text. That means if the healthcare professional is saying you don't need a chaperone, means you are not getting a chaperone. Even if you want a chaperone, I am not giving a chaperone because you are a healthy patient. Right. So answer option C is wrong. So answer option B is correct because here they're telling it is often a question of using professional judgment to assess an individual situation. Okay, so this clearly supports evaluating the need on a case by case basis. Right. And this is the list of vocabulary over here. Right. So that is the fourth question. Right. So let's just have a small recap of the things that we just discussed today. So what did we discuss? We discussed reading part B questions. We discussed what are obligation-based questions. Okay, that is very strong words will be there. There will be no flexibility. Okay, and we went through some sample questions. And then we also discussed what are policy interpretation questions, which means it is not a compulsion, it is an expectation. Suggestion, recommendations, or softer words will be mentioned. So once you have identified, so if it is an obligation based question, what you have to do? You have to go and read, must, what and all compulsions are mentioned over there. Now, if it is a policy interpretation type question, what is expected of them from the healthcare professional? Right. So, like that, if you have a small idea regarding this, it becomes much more easy for you to pinpoint the correct answer. Right. So the detailed lectures are completely available in the app. So those who don't have access to the app, just inform me, because automatically after 30 days, the access get restricted, right? So if you're not able to log in into the app, just inform me. Like I'll be giving you access to the app. Right. So that's it. So that's the end of today's session. We discussed the OET reading part B.